Welcome back. You know, thousands of people are diagnosed with oral cancer every year. This month, health experts and advocates are working to raise awareness about the risks, treatments, and prevention for Oral Cancer Awareness Month. Dr. David Austin with MHS Dental is here to talk about that. You know, most people hear oral cancer and they assume it applies to smokers or those who use tobacco, but I know there are more risk factors involved in that, right?
You're correct. The primary risk factors are tobacco usage and alcohol usage, but we are seeing increased numbers of oral cancer because of HPV. There is a certain strain of the human papillomavirus that is associated with increased incidence of oral cancer. And because HPV is present in all age groups, we are seeing increased numbers in younger people and also in people who are non-smokers.
I could see someone really being caught off guard by this if they get a checkup and they realize they may have oral cancer and they're like, I've never smoked a day in my life. You know, how is this happening? Sounds like that could be happening to some folks out there.
Yes, it could be happening to some people. And that's why it's so important to have patterns of regular care so that you're getting those checkups, getting those soft tissue exams, because it's not just a disease of older men who smoke and drink alcohol now.
I remember even going back to health class in school, we all saw the videos and heard testimonies of people who've had portions of their jaw removed and really had their lives drastically changed by this. The risk factors are there. The preventative measures, certainly folks can probably assume would involve steering away from tobacco products, but there are treatments, right, that can sort of intervene once you get some of those early warning signs.
Well, really, the best treatment is early detection.
Yeah.
So it is so important to have regular appointments with the dentist and make sure that you're getting a soft tissue exam. If your dentist doesn't offer one, just request one, that they do a soft tissue exam. Because of the increase of HPV-related oral cancers, vaccination for HPV is another preventive measure, along with just, you know, making healthy lifestyle choices.
When should someone really be concerned? You know, hopefully, as you mentioned, your regular visits to the dentist would include a check. But if you notice something or feel something in your mouth and you look at it, when should you really be concerned that this is something I need to have looked at?
The big concerns are any sore, ulcer, or unexplained bump that doesn't heal within 14 days.
Okay.
And also the location, if it's in one area of the mouth, that's also a bigger concern than if it's in multiple areas of the mouth. So those are things that need to be checked.
A good relationship with your dentist seems like it's a really key here, because they're gonna know you. They're gonna know, okay, this is something we check on every 6 months or so.
Correct.
Doesn't that seem to be fit right in line with early detection?
Yes, it does. And early detection and then treatment is key to having better outcomes. You know, decreasing mortality, and also treatment-related issues. Well,
we want to, hopefully someone will think twice or you know, keep this in mind and get something checked on. I know this month is very important for getting this information out there once again. Where can people learn more?
Well, you can give us a call, MHS. Go on our website, mhsindiana.com. We have people who can help connect you with places where you can get care, connect you with information resources. And for those who are in need of coverage, we can also assist with that.
Thanks so much for coming in this morning. Hopefully this will help. Even one person out there could make a huge difference for them. And we're going to have much more on this. This will be linked up at our website, by the way, at fox59.com. When we come up next, the sentencing for a man accused of shooting